In this video, we are going to be talking about spinal stenosis. So, what is the meaning of spinal stenosis? Stenosis denotes narrowing of any particular organ. And when we say spinal stenosis, it means the narrowing of the spinal canal. What is meant by the spinal canal? It is the hollow between the vertebrae which actually houses the spinal cord. The spinal cord being the extension of the brain down to the lumbar vertebrae, and then from which different sets of nerves emerge throughout the vertebral column. So the spinal canal plays a very important role in protecting the entire length of the spinal cord from injury. This spinal canal, while housing the spinal cord, has got a provision of some free space around the spinal cord. However, spinal stenosis is a situation where this gap in the spinal canal is reduced. There are two reasons why spinal stenosis happens. Number one is congenital. There are people who are born with a congenitally narrow spinal canal, and that condition is known as congenital spinal stenosis. Patients with congenital spinal stenosis are highly prone to have problems relating to cervical or lumbar spondylosis very easily. Because even with a slight prolapse of the bulge or prolapse or bulge in the disc itself, patients with spinal stenosis are prone to getting more problems, more symptoms relating to even mild degeneration in the intervertebral discs. And so they are highly prone to cervical or lumbar radiculopathy, as it is called. So when the nerves are compressed by the discs that are protruding, because of aging, the height of the disc reduces and they become flattened, and that condition is called as bulging of the discs. And so when these discs bulge even slightly, since already the gap in the spinal canal is narrow in the case of a congenitally prevalent spinal stenosis, patients develop symptoms very easily. The second variety of spinal stenosis is called secondary spinal stenosis, and that is caused by effects of the different tissues that line the spinal canal as a result of aging or degeneration or inflammation. The vertebral spinal canal is actually held in position by longitudinal ligaments. These ligaments hold the vertebrae together so that they don't move away. So they form a very important part in the integrity of the vertebral canal. When these ligaments actually become thick, which is known as hypertrophy of the ligament, that ligamental hypertrophy actually reduces the spinal space, the space in the spinal canal, and that leads to one of the causes of secondary spinal stenosis. The other most important or most common cause of spinal stenosis is by the protrusion of the intervertebral discs, which happens as a result of degeneration or as a result of injury. When the disc's integrity is lost and the disc starts either bulging or it herniates or prolapses into the spinal canal, it goes and touches on the spinal cord or on the emerging nerve roots, resulting in symptoms. So secondary spinal canal stenosis is one of the most important causes of cervical or lumbar radiculopathy as well as cervical myelopathy. Cervical stenosis that is congenital cannot be treated with only medication. Very often, if it is very severe, and patients with a congenital spinal stenosis, if they also have a very severe disc prolapse or a herniated disc, they might require surgery. But secondary spinal canal stenosis very often responds very well to treatment, especially when we integrate Ayurvedic treatment with physiotherapy and other rehabilitation techniques. At AVN Arogya, we treat patients with cervical stenosis and lumbar stenosis caused due to secondary aspects of longitudinal ligament hypertrophy or due to a disc prolapse leading to spinal stenosis. We are able to give patients very good relief by combining Ayurvedic medicines, Ayurvedic external therapies like oil massages, Kativasti, proper Kashayavasti, Snehavasti and so on, combining it with the rehabilitation techniques of physiotherapy and training the patients in certain exercises that help in improving the damage that happens to the nerves, and then the patients are able to be symptom free and lead normal lives. So though primary spinal canal stenosis is very often not treatable, the causes are being congenital, you cannot do anything much about it. But secondary spinal stenosis is very often responding very well, especially if it is due to a prolapsed disc and so on and so forth. So this is how we at AVN Arogya handle patients with spinal stenosis.